Well, hey guys, we are in winter, coming up on spring before you know it. This time of year is a really common time for a condition of the fingers, the toes, the ears, and the nose, ooh, I made a rhyme, to pop up. I really suspect a lot of you deal with this just based on some of the comments I see a lot across my videos asking, what are these reddish itchy bumps that I get on my toes, my fingers? Watch this video because it may explain what you're dealing with. I'm going to explain why this happens. And importantly, I'm going to be giving you tips and tricks to prevent it from recurring. Okay, what the heck am I talking about? The condition is called perniosis, also called Chilblains. And basically what happens is when you go out and are exposed to cold and wet conditions, well, some people develop light pink, red to purplish bumps, often on their fingers, toes. Also can happen on the nose and the ears, and it's really, really itchy for a lot of people. It can be painful, and it usually appears not when you're actually out in the cold, wet climate, but rather when you come in, especially if you go and try and warm your hands and feet really quickly, you'll notice that this starts to appear. It's not just these locations, although those are the places that are most common. You also see a variant of this actually in equestrians on their thighs if they, ride horses out in cold, wet conditions and they're wearing really tight pants because that constriction leads to this problem, and I'll explain why in a moment. So who gets this? Well, anyone can get it. It happens to people in all age categories. We see it a fair amount in young children on their little feet from time to time, the elderly, but it's most common in young to middle-aged women. Women more so than men deal with this, although anyone can get it. At its root, this condition is something called a vasculitis. What that means is that inflammation develops around the blood vessels in the skin. Risk factors for perniosis include people who smoke or use nicotine. Smoking and nicotine, it's not great for your circulation, so it can cause this problem. Also, people who are of a low body weight or have poor nutritional status. If you're on the slighter side, you may have a greater tendency to develop this. Certain occupations because of their exposures. If you're ice skating, hockey, to a certain extent, there is probably a genetic component, as this does appear to occur more so in families, so there's a familial tendency. But there are a subset of people out there for which perniosis is actually part of a larger problem. Mostly people who have an autoimmune disease known as lupus. Now, lupus is a very complicated medical condition, and it can affect the skin in many different ways. And one way it affects the skin is called lupus pernio. This is actually a lot more common in temperate climates versus cold climates where the air is dry. Part of that has to do with the fact that if you live somewhere where you have a long, cold winter, chances are, you dress appropriately for it, you're prepared for it, and the homes and buildings, they're just better equipped to handle the cold in general, plus the air is a lot drier. It ends up being a lot more common in the late winter, early spring, when it's still cold out, but it's well above freezing. In 2020, we started seeing a lot more cases of perniosis. We were seeing it in a lot of young children, young adults who had like a mild infection with the virus. So the vasculitis, the perniosis, which is a vasculitis, it can happen, as a result of a viral infection, like the immune system just kind of gets a little wonky. We also saw a lot of cases of it at that time because people who weren't necessarily infected, they were at home and not as mobile and looking at their feet and hands. And like I said, you can develop this as a result of cold, wet exposure. So people, were not moving around as much, and that's kind of a scenario where you might develop it. So we saw just a lot more cases of it at that time. What exactly happens though in the skin to cause this? What happens is, normally when you're exposed to cold temperatures, what happens is that the blood vessels in your extremities, your hands, your feet, they clamp down, they constrict, because they want to keep, the thinking there of your body is to divert as much of the blood to your core to keep your body warm. But after a certain amount of time, your body kind of has a compensatory effect to dilate those blood vessels a bit so that you don't like starve your hands and feet of oxygen. However, when you are exposed to these cold, wet temperatures, it's kind of like there's a little bit of dysregulation in the vessel constriction dilation phenomenon, and you end up getting little episodic bouts of basically low oxygen content that brings in this inflammatory infiltrate into the skin, inflammation around the blood vessels, and that's what leads to those light pink to violet appearing itchy bumps, areas of the most commonly fingers and toes. One thing about perniosis is that it can really be worsened and brought out as the result of rapid rewarming. So it's not even just the mere fact of being exposed to cold, wet conditions. It's a lot of it is triggered and aggravated by when you come inside. If you like rush over to a heater and try and heat your hands up too fast, you try and warm yourself up too quickly, the regulatory mechanisms are kind of like, whoa, 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 what's going on here? And that really actually can aggravate it quite a bit. The normal course for perniosis is it typically develops within 1 to 2 hours of exposure to the cold, wet temperatures. And otherwise healthy people who don't have like an underlying autoimmune condition like lupus, it typically resolves, usually maybe within 24 hours, but depending, on your exposures, you may deal with it off and on for a couple of weeks. And then when the temperatures warm up and things, are not such that you're exposed to cold, wet temperature anymore, it goes away. And it may come back again the next year or, later on when you are re-exposed again. But by and large, it's not, for most people, I should say, it's not like a dangerous, life-threatening thing. But it definitely can be uncomfortable. It can be itchy. You can get this kind of burning pain, discomfort. You can have a little bit of swelling. But in real severe cases, especially in patients who have lupus and are dealing with this actually as part of a more complicated underlying vascular problem with the blood vessels, they can actually end up getting little ulcers because, the blood vessels are kind of almost spasming in a sense and getting inflamed, and the fingertips get deprived of oxygen, so the skin almost has like the equivalent of a heart attack but in your skin, and because of that you develop little ulcers. You can get secondary bacterial infections. It can be quite serious. Another group of people where you have to be careful with this too are like diabetics. A lot of that has to do with the fact that diabetics, they have vascular problems with the blood vessels, but they also often have neuropathy, problems with little nerves that course through that area. So they don't have good sensation. And so it's easy for them to develop skin infections if this gets, out of hand, poorly controlled, and they're not frequently checking their feet. One thing about the redness is what we call blanchable, meaning if you press on it, it'll turn white. And then when you relieve your finger, relieve the pressure, it'll turn red again. In most cases, it is what it is. It's pretty straightforward to diagnose. But in patients who this is occurring a lot, or they have, lupus, for example, other things going on, other medical problems especially, well, then they may need some testing. I would not hesitate to do a skin biopsy for some people to rule out other things that kind of look like pernio, and also order blood work. There are some blood tests that can be really helpful in this situation when it's not, looking like just run-of-the-mill sort of benign pernio that comes and goes. Let me know in the comments though, do you deal with this? Like, does this sound like something that you're dealing with? Because I like I said, I see comments from you guys and I'm always like, I'm pretty sure that's pernio, but I'm not able to, this channel, to remind you guys, is not intended to diagnose or treat anything. I'm merely providing educational content, just gleaning from the comments that I see. I always think to myself, maybe I should do a video on pernio based on what these people are describing. So here we are. So let me know. And also, it's not as common, but it definitely can pop up on your nose. I see a lot of comments too on videos, especially when I'm doing a video on rosacea. I'll see a comment, why does my nose turn red for, days and days? I don't think I have rosacea. The rest of my face isn't red. I don't get red cheeks. I'm not sensitive to spices. I don't flush with alcohol. Could be this, okay? It could be this, perniosis. Think of it as the blood vessels, they get a little spastic upon exposure to cold and damp. conditions. So how do you stop this from happening? Okay, first of all, if you smoke or use any kind of nicotine, stop doing that, because basically nicotine causes vasoconstriction and it makes this problem significantly worse for you. Likewise, if you use illicit substances, especially those that sound like Coca-Cola, if you know what I mean, don't do that. Okay, don't do that. Definitely gonna not be in the best interest of your skin. Let me tell you. I mean, this is just the tip of the iceberg when it comes to skin problems that can go awry with that little hobby of death and destruction. Okay. Also check in with your doctor. You know, maybe you're on some medications that are called vasoconstrictors. Maybe the dose needs to be adjusted so that you don't have these uncomfortable symptoms, because that can definitely make it worse. You know, avoid cold, wet temperatures as best you can, especially in the late winter, early spring. You want to try and minimize draftiness in your home, and it actually can end up being quite helpful to have a dehumidifier to help with the draftiness. Now, that's, you know, a contradiction to my typical winter skincare tip, which is, you know, if you live somewhere cold and dry, your skin's getting dry, get a humidifier, can help with the moisture content. But for this scenario where your foe is now cold and wet, dehumidifier can help with that cold draftiness quite a bit. As a matter of fact, I can attest to that myself. While I don't deal with pernio, I do not enjoy cold draftiness, and I got a dehumidifier that I've been running over the past, you know, year or so, and oh my gosh, it's definitely helped a lot. So that might be something that is very useful to you. Make sure to do your best to heat your home and keep it dry, because those drafts, they can really do a number on this. When you are going to have to go out and it's cold and wet, warm up your shoes and your socks and gloves before you go out, because you want your hands warm before you go out. Warm them up in advance. Make sure they are dry. You know, this is especially a problem for people who do like ice skating and stuff. They may put on ice skates that are still wet or something, and it's cold and wet down in their shoe. So, you know, keep that in mind, okay? You wanna make sure that your stuff is warm and dry. That can definitely help quite a bit before you go out. Make sure that your shoes, your socks, your gloves, make sure that they fit you, that they're not too tight or restrictive. Likewise, especially if you're doing some kind of sport in a cold, wet climate, don't wear really tight clothing. Restrictive clothing can bring this out. It's mostly a condition that appears on the hands and feet, but it also can, like I said, with equestrians, it can happen on the thighs as well. So make sure you're wearing comfortable clothes that fit you well, that are not too restrictive. In addition to warming up your socks, your shoes, your gloves, maybe have like a little heating pack that you hold on to before you go out. Drink some hot liquids beforehand, eat a warm food like oatmeal, soup in the morning, you know, on a cold, wet morning. That before you go out can really actually help you quite a bit. Patients who deal with this a lot, I always emphasize the use of moisturizers to the hands and feet. I mean, I encourage everyone to do that. Use just plain petroleum jelly as a barrier support. It can really end up helping secondarily as a result of the dryness that you most likely will develop if you deal with frequent bouts of this, especially if you have lupus. If you have lupus and you deal with this, yeah, definitely, you know, take these measures a lot more seriously, because like I said, it can be a lot more stubborn in lupus, and it also, you know, can ulcerate, put you at risk for infections. Importantly though, when you come inside from a cold, wet exposure, don't warm yourself up too quickly. Don't go over to the heater. You know, when you get into the car and you crank the heater up and you're like, I know that feeling, but that definitely can aggravate it, because it's the rapid rewarming that actually is a tricky component, okay? Stay active. You want to be moving regularly, getting good exercise, staying ambulating around. Don't, you know, turn into a couch potato. That's really where this can get much worse, because, you know, when you don't move around, then there's not a lot of blood flow down there, and the blood vessels, they'll rebel. If you have diabetes, make sure you are following up with your healthcare provider regularly, having people look at your feet if you're not able to look at them yourself, because like I said, you know, diabetics definitely can deal with this, and they oftentimes have neuropathy, poor sensation down there. So it can be a lot worse than you might realize. And like I said, if it goes to a point where it's causing ulcers, that definitely can be quite a harmful thing for you, a portal of entry for microbes. Okay, so that's how to prevent it from, flaring up. For most people, it's just this nuisancey thing that you deal with when it's cold and wet, and then, spring break is here, it's warm, it's sunny, and it's something you forget about, and you're fine, it resolves. But for other people, especially people who have underlying health problems, medication might actually be needed because this can be really uncomfortable, and if you're dealing with it a lot, it can really be unpleasant and potentially very deadly if the problem ulcerates, okay? So treatments that can definitely be helpful. Topical nitroglycerin, because it helps dilate those blood vessels and keep them open. And then, when it's real itchy, so of course, topical steroid ointment, a real strong steroid because the hands and feet, the skin there is really thick, or a milder steroid for the tip of the nose, that can help with the itch. And also kind of help calm down the inflammation a bit, because if it's itchy, you scratch, it ulcerates, the scratching can introduce bacteria and stuff, so that definitely can help. Class of medications called calcium channel blockers, used to treat blood, high blood pressure. They actually can be quite helpful. So something called nifedipine definitely can help. But for most people, they don't end up needing to take a medication for this. It's just for people who have, more of an involved presentation. All right, guys, that's what I wanted to talk about, but I know it's a problem that a lot of people deal with, don't know what it is. So hopefully this was informative to you. Thank you so much for making it to the end. Now, if you are in the midst of cold winter, wherever you live, I'm sorry. I hate the cold. But on the end slate, I am going to put my video all about my winter skincare tips. So check that out because I give a lot of information in there that you might find useful. But if you like this video, give it a thumbs up, share it with your friends. And as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.